Hey friends, this is Ian Khan again at HIMSS, and I'm here with Dr. Aaron Neinstein with Notable. Let's see what's happening in AI and what they're working on. Dr. Neinstein, welcome to the Futures podcast here at HIMSS. You guys are doing a lot, and we'll talk about a few of those things. Tell us about Notable. Tell us what you guys are all about, and then we'll get deeper into our conversation.
Yeah, so Notable essentially is about doubling workforce productivity at a fraction of the cost. So if you look at what healthcare organizations are up against today, we're seeing staffing costs really spiraling out of control, hard to keep businesses operating at a healthy margin, and it's hard to find staff to do jobs like revenue cycle, contact center. And so we provide a digital workforce through AI agents to help organizations meet their goals, serve their patients better, but at a reduced cost.
So at HIMSS, there's a lot happening with AI. AI is not just at HIMSS, but every industry is trying to figure out where it's headed. I've heard a lot about agentic AI at HIMSS and many other cool things. Help us understand some of the main key areas within AI that you guys are working on and bringing it forward.
Yeah, I think the key differentiator is an AI agent can take action proactively without a human involved or triggering something happening. And so an example of this is prior authorization, right? So I'm an endocrinologist, and so half my practice now is Ozempic prior authorizations or Dexcom and Freestyle Libre prior authorizations. Well, normally when that prior authorization is required, the practice gets a fax, it sits on a fax machine, and it's waiting for a human to pick it up off the pile. Mm-hmm. So that's the first delay in service. Then the human has to go dig through the chart and pull information from the chart to support the prior authorization, look through the doctor's notes and provide it. Then they need to go enter that information into the insurance company portal, get an answer back, and that finally completes the prior authorization. Well, what an agent can do is actually mimic the human steps in that process. So the second that the order is placed for something like Ozempic, it can actually take that order and proactively go find the information in the chart, summarize it and pull it forward, submit it into the payer portal, return that information back into the EHR, and do that whole series of steps really, in many cases, without human intervention.
So if we were to differentiate what is different now with AI, what is it? Is it the availability of data that was never there? And of course, a big part of AI is having the data in the first place, right? And super connected, interconnected, interoperable. That's part number one. But what else is now a big revolution? Is it the fact that because of AI, this automation is working fast, or because it's intelligent and it's able to do things that we were not able to do before?
Yeah, great question. So, Notable has been an automation platform for almost a decade. And so in the early part of our company's history, we would integrate into electronic health records, get data in, put data back. But we were using earlier methods of AI, right? So building an algorithm to identify whether a patient had a diabetic eye exam and pull that information from the chart. Well, to build all those components previously was expensive and slow. So we'd have to build character recognition to read scanned documents and read that ophthalmology note. We'd have to build predictive algorithms to go in and look for the phrase saying, does the patient have retinopathy or not? Well, the availability of foundational large language models has made all of those capabilities much more accessible at a lower cost. And so things that used to take us months to develop, we can now develop in days to weeks.
Yep.
And so having that foundation of deep relationships with our existing customers, almost a decade of integrating into electronic health records, but now supercharged by the availability of cheap foundational large language models, just means everything can move much more quickly than it was able to in the past.
Excellent. So we definitely have the speed now, and you're able to scale this into a massive amount as needed, and that I believe is what is the advantage. When you look at the next, let's move to the future. Let's move the next 5 to 10 years. What kind of transformations do you see happening in healthcare, and how? Maybe 3 years, and then let's do a 10-year or 5-year and 10-year.
Yeah, I love that you're asking this because I often think a cognitive bias, should we say, that I often hear people fall into when they think about AI is everyone's first reaction is AI is coming for my job. And if we think about today's healthcare system, there's so much that isn't happening that we wish could. And so the way I like to frame everything is come from a place of abundance.
Yeah.
And so if you think about, yourself or a family member, last time someone went in for a surgery into the hospital, think about that experience and what was missing. Who was calling before the procedure every day to make sure that you felt well educated, well informed, were prepared, stopped the right medication, stopped the aspirin, and then when you leave the hospital, was there anybody calling to check up every day, whether you're having symptoms? And so those things are missing today from the healthcare system, unless you're in a concierge practice spending $10,000 to get concierge level care. And so I think what's becoming increasingly possible is a level of concierge level service and care and attention, but for everybody. Which is what we all want.
Yeah. There's this human element of AI that always comes into place. And of course, healthcare is one of those industries where the human touch, the human person, the doctor, the physician, the healthcare professionals, they are always there to make sure care is being provided. How will AI complement healthcare providers, the nurses, the doctors, the healthcare system? How will it complement? And I'm not saying displacing them. It's all about complementing them and augmenting their work.
I think this is so important. The thing that keeps a lot of doctors up at night, the thing I worry about is things falling through the cracks. And it happens every day. So I have so many examples just from the last couple of years of the inbox message that I missed from a patient asking for an insulin refill, and they ended up in the hospital with diabetic ketoacidosis because I missed it. Or the new referral that was sent to my office, and we missed it, and a person with type 1 diabetes was waiting for a year to come in and see me. Or the prior authorization for Ozempic that was sitting in the pile and we didn't have time to get to it. And so someone who had lost 30 pounds regained all the weight because they went months without Ozempic while their prior auth sat in the pile. And so today, all of these things are falling through the cracks of our systems. And as a doctor, that drives me nuts because the issue is less about, do we know what diagnosis you have? And there's so much obsession with AI and like making a diagnosis, but that's not the problem. The problem is actually executing on the care plans that we develop with patients and making sure they happen and making sure that things don't fall through the cracks. And so as a provider, that's what excites me is having a assistant who's like the best medical student I've ever worked with, who's making sure that things aren't falling through the cracks with my patients, who's preparing me before I walk in the room to sit down. If you're an oncologist, you want to walk in the room and know what recent imaging and pathology the patient has had. You want to know what questions are top of mind for them. We don't have time to prepare all of that information ourselves. And so summarizing that for the provider, preparing us so that we're ready, and then knowing that things aren't going to fall through the cracks. Like to me, that's what we all want.
Oh yeah, I was just thinking about this, and I was trying to create a scenario. So before technology was there, computers or what have you, like 40 years ago, 50 years ago, everything was manual. Everything was just written in ledgers and with hand. Great. In came computers, we saw a lot of automation, we saw speed and agility and the transfer of information from one place to the other, electronic health records started happening. Great, I love that. But with that automation, I think the ability to, which when you said things are falling through the cracks, like, you can't drop a ball on a surgery or a critical healthcare issue. And those kind of crept up to us, not just in healthcare, but every industry. And now AI can make sure nobody drops the ball. There's no cracks, nothing falls through the cracks. And we have the speed and agility, the data is coming together. And I think this is like a superpower in the hands of everybody in the healthcare industry, where now you can actually deliver the care that you signed up for and you promised, right? Isn't that incredible?
Incredible.
And whether it's agentic AI, LLMs, or what have you, I feel we need to do a better job, generally the industry, the out there, in simplifying this and helping understanding, here's the value we're talking about. It's not about, how many parameters the generative AI platform has, but it's about, hey, what's the value? So I think many conversations today are very technical and people get bogged down with it,
so
right?
Here's a really simple one. So think about how often you go see your doctor and they're in a rush and you have this list of questions in your mind and you either don't get to them all or your doctor has to leave the room.
Always.
Right? Happens all the time.
Yeah.
So one of the things that we've deployed recently is a simple AI phone call, goes out to the patient a few days before the appointment and asks them what are the top items on their list that they want to discuss with their doctor. They take all the time they need to answer. You can prioritize which of these are the top priorities. And then we surface it to the doctor before they walk in the room so that the doctor knows these are the top items on the patient's list. Just a simple thing like that.
Yeah, it's easy for everybody to understand what the key problems are. But I love it. Thank you so much for spending your time. Give me your 3 pieces of advice for everybody who's watching this and who's at HIMSS or not. But what are your 3 key takeaways for anybody out there?
So one is, I think, we all realize that AI comes with risks and benefits. And I think there's often a rush to compare AI to perfection. And so Zach Kohane wrote a paper in New England Journal where he said, we shouldn't compare AI to the healthcare system we wish we had. We should compare it to the system that we actually have. So number 1 is when we're looking at AI, compare it to the system that we have today, which is badly broken in many places, and resist the temptation to ask AI to be perfect, because we are not perfect today. The second thing that I think is important, and I worked in health system IT for 15 years and was a buyer and implementer of systems, I do think that it is important to have the right number of vendors that you're working with. It was very hard to buy a solution for every single problem that you have and try to stitch and integrate them all together. This is why EHRs were so successful 20 years ago. And so I think being cognizant of choosing core platforms that can solve a lot of problems for you with one vendor that you trust is also critically important. Third thing I'll add is start with the right use cases. Again, I think the mistake made in healthcare over the last 30 years with AI was focusing on making a diagnosis. That is very hard to do, very high risk. There are so many things, if you look in the back office at your fax transcription and prior auth, that are low risk, high impact, and great places to start. So start with those core use cases that I think are low risk and high yield.
Incredible. Thank you so much. And that's Dr. Neinstein with the CMO, Chief Medical Officer with Notable. Thank you so much for your time. Really, really appreciate it. Best of luck at HIMSS.
Yeah, thank you so much.
Thank you.